Good afternoon. Thank you for joining us today for the Power of Claims Analytics, Launch Growth and Innovative Strategies with Competitive Claims Intelligence, presented by LexisNexis Risk Solutions. Before we launch into the main presentation, I'd like to go over a few housekeeping items. Today's event will be approximately 1 hour long and will be recorded. We will email you a link to the archive recording so you can view the presentation again or share with a colleague. Please disable your pop-up blockers to ensure you have no trouble viewing the slides in today's web event. Please note this is an interactive event. Feel free to submit questions to our speakers using the chat box on your screen. If you would like to enlarge your slides, you may do so by dragging the corner of the box. This will allow you to make them larger or smaller. All of the widgets are also resizable and movable, so feel free to move them around to get the most out of your desktop space. If you have any technical difficulties during the webinar, refresh your browser link to refresh the console. If that does not work, please reach out using the Q&A box. Finally, at the end of this event, we will present you with a survey. If you would, please fill it out and let us know your thoughts on today's event. At this point, I would like to introduce you to today's speakers, Richard Grape and Rebecca Hauk. Richard is the Senior Director of Strategy for LexisNexis Risk Solutions. In his role, he acts as part futurist, part visionary, and as a strategic leader that directs the overall market, product, and sales strategies as it services government and healthcare nationwide. A passionate advocate for the benefits of sharing data, he has led multiple contributory initiatives and defined data sharing for frameworks such as the National Accuracy Clearinghouse. Holding a Bachelor of Arts degree from St. John's College and a Master's of Public Administration from Cornell University, he brings a unique perspective fueled by expertise in government and healthcare policy, public-private partnerships, as well as less traditional disciplines such as political theory, philosophy, and classical studies. With over a decade of industry experience, he enjoys applying his market and subject matter expertise to solving complex industry problems. Rebecca serves as the Market Planning Manager for LexisNexis Claims Analytics Solutions. In her role, she serves as an industry SME, working to set the product suite's roadmap and vision, engaging with cross-functional teams to identify potential enhancements and new products, evaluating market opportunities and conducting market sizing, and building documentation to support go-to-market processes. Rebecca is a key contributor for the LexisNexis MarketView Innovation Strategy and brings to bear her expertise in Medicaid claims data sets, behavioral health care performance measurements, and monitoring data collection, analysis, and visualization. Rebecca holds a Master's of Public Administration from Cornell University, as well as a Bachelor's of Arts from the State University of New York at Geneseo. Thank you for being with us today. I'll now turn the presentation over to you, Rick, to begin.
Thank you, Shannon. And thank you all for taking the time to join us today. We're going to be taking you through a couple different topics over the course of today. First, we're going to kick off with our session by taking a critical eye and deep dive into some of the industry trends that were already shifting in the market in a pre-COVID world. We'll then look at some of the challenges that were encountered as healthcare has shifted to providing care amidst the pandemic, and then ultimately how claims analytics can help grow your growth and innovation strategies really through competitive intelligence and the different insights that that can provide for the various parts of your business. To kick off our session, we're going to focus on some of the major industry trends that have been impacting the health, hospital, payer systems throughout our healthcare ecosystem and the broader healthcare market as we've moved into the early part of 2020. With COVID, and while this has resulted in a shift in a reprioritization of not only resources but business priorities, these factors are nonetheless relevant and top of mind in addition to those needs for more tactical pandemic and disease response. So to start this, we're going to talk a little bit about the initial market trend, and that is the move from volume to value. This market shift is really hallmarked by a strong shift towards what we call alternate payment models, or APMs. And these are indicative of value-based care approaches. Level setting, as we all know, 10 years ago, health insurance was paid on volumes. And over the past decade, we've seen a shift from the number of services to the quality of those interactions with market attention really driving an increase in accountability. Volume-based reimbursements are commonplace, though they are starting to trend towards more and more of that value-based model. In the market today, we see really four major categories of different payment models. Category one are traditional fee-for-service payments. These typically have no link to quality. They're not adjusted for infrastructure investments or capturing provider reporting of quality data or performance or different cost or quality metrics. Category two are fee-for-service payments. So these are linked to quality to some extent. Their payments are adjusted based on those different infrastructure investments that help improve care or clinical services. And it factors in things where providers might be reporting on provider quality or quality of data for the patients, as well as some cost and quality metrics. Category three, and these are really the start of the APMs. These are built on a fee-for-service architecture. So these are providing mechanisms for more effective management and sets of procedures, episodes of care, all the different health services that are provided to individuals. These track cost and performance and hold providers and payers financially accountable for the performance and the appropriate care measures for their populations. And then the category fours, which are really population-based payments, these are providing and driving really providers to deliver person-centered care. And we're going to talk about this, I think, in a little bit of greater detail as we get down towards some of the shopping for healthcare components. But these are where they're very patient-centered and person-centered in goals, including preventative health, health maintenance, health improvement, acute and chronic care type settings. So as we take a look at some other metrics tied to these models, you'll see that of these different categories, APMs really account for about 35% of payments, but really they represent 77% of the covered population, so roughly 226 million Americans, so the majority of our national population. This shift represents what we'll talk about a little bit later on as the move to consumerism, or the focus on a patient-centered or patient-centric approach. While fee-for-service will continue to represent a high percentage of payments, the decline is already underway. We've seen a 2% decline in the last year alone. Many industry goals have these APMs set to grow by 50% or more within the next 5 years. So it's definitely an industry trend that is continuing to impact our populations nationwide, and we should continue to see evolving and really shifting the way that we deliver and ultimately provide care for the different covered populations within the United States.
So over the past few years, we've also experienced a firm shift towards patient responsibility. So patients are charged with greater ownership of the financial burden for their healthcare. This is, hallmarked with a shift from PPOs to high deductible plans. Employers are seen to be lowering their costs while increasing the monthly patient insurance costs. So the result, patients are paying more out of pocket, and this is changing their buying decisions. So if you look to the right, you see that in a recent survey from Bloomberg, the percent of Americans who have moved to high deductible plans has grown considerably since 2010. So patients have not only shifted where they receive care, but also which plans they choose during enrollment, with patient out of cost being a main driver of those decisions. With the increased patient financial responsibilities comes the need for price transparency. So last year we saw the execution of a presidential order requiring hospitals to publish prices that reflect what people pay for services. This action, a step beyond what had been started through the ACA's requirement for hospitals to publish standard prices on the internet, is designed to increase price transparency and thus better the consumer decision-making process. So while the spirit of these efforts is to make costs more patient accessible, their execution has been poor to date. So hospitals have addressed this need by making their charge masters available online. These are not really searchable, as easily accessible for your average consumer. It can be hard to decipher them. One example might be, what we're seeing on the screen here is we're on page 456 on a website. It's hard to log in and find the cost that you're really looking for as a consumer. So towards the end of 2019, we saw President Trump propose a new price transparency coverage rule, which would require health plans to disclose on a public website their negotiated rates for in-network providers and allowed amounts paid for out-of-network providers, give consumers real-time, personalized access to cost-sharing information, including an estimate of their cost-sharing liability for all covered health care items and services through an online tool that most group health plans and health insurance issuers would be required to make available to all of their members at the consumer's request. So this requirement would empower consumers to shop and compare costs between specific providers before receiving care. So this final rule requires, we're talking really hospitals and payers having to work through price transparency and make this information easily accessible to the consumer, which I think really brings us to our next industry trend that we're going to talk through around consumerism.
Yeah, and for those of you that are on the phone, before we move to the consumerism piece, Rebecca, we had a webinar a few weeks back, and as many of us will have heard or know, that there was an attempt to push back on some of the price transparency obligations, and that ultimately didn't receive traction during June of this year. So we have polled and kind of gotten a little bit of feedback from folks, and while most of the focuses of the provider audience for that specific webinar anyway that we were talking about indicated that they've been obviously very consumed with COVID-19 and the pandemic response activities. And many of them were also in a wait-and-see type fashion and attempting at this point now to shift gears and start to focus on how they will ultimately meet the goals of publishing that standard pricing. So that's an area, as you all within your individual businesses start to focus on towards the end of the year. I believe the initial requirements for that are January of 2021. So it's becoming top of mind, though I'm sure it has been a little bit lower or backburnered priority as a result of everything that's been going on this year. And if I had to place my own individual bets, I'd say that there's a possibility that we'll see some amount of delay just tied to the pandemic response activities that have occurred so far. So to Rebecca's point, that is kind of the setup really for what we're seeing as really the next industry trend, and that is the shopping for healthcare that is occurring across the board. And this is the shift towards what we term or reference as consumerism, and that's really capturing the consumer mind share and preference in order to help not only with market penetration, but to ultimately own more and more of that experience. As you know, patients have a lot of options on their plates nowadays, and they have an opportunity to shop and look at reviews and services, hear testimonials, and keeping them within network for hospital systems, keeping them within plan or helping them devise the right plan that they would ultimately select based on those preferences is part of this shift. And part of the goals that is something that is challenging the industry more broadly. This last sentiment of kind of needing to effectively gain consumer mind share and keep those interactions and associations positive really is highlighted by the fact that consumers can pick and choose where, when, and from whom they'll want to receive services. In many ways, I've heard this referred to as kind of a shopping mall type approach, where consumers are picking and choosing who they want to manage their care and why. To give kind of a personal example of this, so I recently had a baby within the past year. It was our first, so many changes are kind of ahead of us in terms of where we're going and the different life events that will ultimately unfold. But those life events and life events like having that child ultimately will influence in many ways where my family will likely go to receive health care. If my insurance company or a doctor didn't require me to go to a specific hospital or go through specific testing, there's a number of opportunities that could be missed out to not only have me engage with them in those individual experiences, but ultimately choose to go back for different life events as a result. My daughter entered the world with a little bit of difficulty, but the hospital that we were at met those challenges, and ultimately they earned our loyalty. So as a consumer, if we do have another one, we are heavily likely to go back as a result of that. And this actually, I think, kind of highlights some of the shift that's occurring in terms of the need for that patient engagement aspect, and I'm sure this is top of mind for many of you. Part of keeping consumers engaged and enrolled in your individual plan, services, network is partly tied to that lifetime value of the patient, and that's roughly 1.4 million is estimated per lifetime value of a patient, depending on the different procedures and whatnot that they will likely undergo. There are things that help in terms of keeping their attention and keeping them their experience positive. Some of those metrics are things like reductions in medication errors, if they're in a hospital system, a reduction in the number of falls or decreased lengths of stay. Ultimately, though, it's helping them attain a higher level of outcome for them to not only have that management at the point of care, but the ongoing follow-up, the ongoing consulting, the ongoing positive experience, because ultimately that will impact their reviews, that will impact the experience they choose to share with others, and that itself can drive preference for a specific hospital, a specific plan over time. I know when I've had open enrollment, some sections of where I will choose to do my healthcare are largely driven by the experiences I've had, not only with the plan itself, but the individual practitioners that might be servicing that plan. So this kind of brings us through the first kind of pre-COVID industry trends that we've seen and are kind of the baseline for where we are this year. We're going to transition to our first polling question from the group. Shannon?
Yes, thank you, Rick. Our first polling question is, you see from the group, which industry trends were of greatest focus for you or your organization prior to COVID-19? Was it the adoption of alternative payment methods? Was it designing plans with greater deductible options? Was it meeting the new price transparency requirements, or increasing patient engagement and keeping members in network? I'll pause for a few seconds and let you all make a selection.
And Rebecca, I'm really curious to see kind of how this poll lands, because I know many folks have been focused on the transition from fee-for-service, but understanding whether patient engagement is top of mind or those price transparency rules are top of mind, especially as we've seen more and more adoption of competitive claims intelligence in the past year or so.
Yes, Rick. It looks like we have most people were interested in increasing patient engagement and keeping them in network, followed by adoption of alternative payment methods.
Okay. Rebecca, what are your thoughts on those trends? Anything to share?
I think it's not terribly surprising, because I think that, especially when you're talking, Rick, about the value of a member and their lifetime of care, that really wanting to keep them in network is going to be top priority. I think that makes sense. And then there has been this shift towards this value-based care from volume to value. That shift has been going on for quite a few years now, and so that doesn't surprise me. I am a little surprised that we're not seeing some folks talking about price transparency, but we did ask for greatest focus, and we didn't allow you to have multiple selections. So I don't think that this is terribly surprising. It's definitely it's good to know kind of as we move through our presentation where folks stand.
Yeah, and there's a lot of factors that can go into helping patient engagement, just talking to the audience as a whole, thinking like SDOH type factors of where populations might be at greater risk for additional services. Those attributes can help reveal where someone might not have access to things like transportation and reliable trips to the grocery store, and if they happen to have specific diagnosis and need treatment, making those things more available either through telehealth or Meals on Wheels, if they happen to be in a food desert, things like that can greatly influence the outcome of their care. Like you, Rebecca, I'm also very surprised that we didn't see more in the price transparency category, especially with the potential implications that rule will have in making those rates and contracted rates available and viewable across all plans. That was surprising. I'm excited to hear kind of some of the results from folks in some of the later polls. I'm going to shift our gears right now to the industry trend that's probably been top of mind for all of you, especially over the course of the past 6 to 9 months. We're all feeling the impacts of the current pandemic from COVID-19. We've seen in recent days how the population across the globe has been impacted. This pandemic has characteristics and trends that really distinguish it from any other in modern time. We've seen high mortality rates, especially among the elderly populations and those with one or more chronic conditions. We've seen it's highly infectious with a longer incubation period, which is causing a significant spread among either unsuspecting or asymptomatic individuals. And we've also seen in a fairly short window a high demand for a lot of the different critical care life support equipment, not just the machines, things like respirators and ventilators themselves, but also for the critical care personnel that are supporting all of those diagnoses and treatment of impacted patients. As we look across the U.S., it's really clear that COVID has no borders, as every geography and every community and population is now experiencing some level of exposure and loss. If you look at the map that's on the screen here, you'll actually see a breakout of confirmed and deceased populations. This is originating from one of the industry's leading data sets for COVID-19, the Johns Hopkins data set. And there's a hyperlink you'll see at the bottom left in the event that your organization would like to go learn a little bit more about that through GitHub. As we've looked at how the pandemic has kind of impacted our different communities early on, it really prompts in my mind two major questions. The first of which is which communities are the most at risk for poor health outcomes due to COVID. You'll see here on the screen, there's a couple different high-risk age and comorbidities that are listed. This is really a review based on different clinical research of populations that began falling ill early in the pandemic, showing really higher correlations to underlying conditions. While everyone's at risk of contracting COVID-19, the CDC has also indicated that certain individuals based on age demographics or underlying conditions are at a higher risk, and this ultimately is really challenging our population as a whole. You'll also see in here socioeconomic factors have been added in as an area that folks are starting to evaluate tied to the pandemic. And this is really populations, again, that might be in need of social and economic support outside of the typical norm. As we as a business have been engaged with folks that are doing research on the different comorbidities, you'll see that we've had questions come in from individuals specific to more high-risk comorbidities that are impacting a greater breadth, those with heart disease, diabetes, hypertension, lung disease. And it's probably a little small on the screen, but in the bottom right, you'll actually see some of the co-occurring diagnosis that we've seen with COVID. This is looking from April when that initial window went forward and through a couple months from our claims history, but this is a good indicator of which comorbidities and then which common diagnoses are occurring in parallel as that started to be documented across the population. As we shift gears to kind of what I think of as the second main question, this is really which communities are most in need of critical care resources. So I mentioned before, there's some resource gaps that are more technical in nature, machines and ventilators. We've also seen a significant amount of discussion and need from different health and hospital systems tied to key specialty providers. You'll see here there's a number of key specialty providers, folks like anesthesiologists, hospitalists. You'll see cardiologists, pulmonary specialists that have been in high demand. And these therapists, these different practitioner specialties are starting to be more and more readily available to impacted communities through mechanisms like telehealth and the like. But they are also where we've seen when a community is heavily impacted, a potential need to reach out to their neighbors, their peers, especially at a hospital system level, to look and reach out to practitioners that can come in from less impacted areas that are within a relative close geographic range in order to help provide some of that treatment. You'll see in the bottom right, there's also a chart here from the CDC, and this is outlining some of the population risks that are kind of spread across, looking at kind of an age grouping as baseline. Specifically in here, I know we've talked kind of at length about high-risk populations and those that are older in years, specifically being those impacted. You'll see here from a deceased and mortality indicator, as folks start to get to that 65 and above range, they're 90 times higher compared to those in the 18 to 29 range. And then as they get to 75 to 85, 220 times higher, and then over 85, 630 times higher. To have an adverse reaction and effect from contracting COVID and ultimately having a poor outcome as a result of that diagnosis and its treatment. This specifically was very insightful to me as we started to look at the heavily impacted populations and really seeing what a massive factor that age demographic was playing on the population's ultimate ability to recover from the disease. The next area I want to talk briefly about is the utilization of telehealth and really its adoption overall nationwide as we've seen the pandemic progress. As we've looked at telehealth, we've evaluated a few different ways. First, we've looked at really the increase that we've seen in telehealth as a whole. Now that there's been temporary guidelines to allow providers and practitioners to go down that path. But there's also been a massive adoption of telehealth among specialties that have never historically had telehealth services. We've seen high jumps, sometimes in over going from a couple hundred claims to hundreds of thousands of claims, so like 150 +% increase overall in areas like gastroenterology, assistive therapy, behavioral care, pediatricians that are suddenly seeing patients that way for the first time. Post-pandemic, I think we'll continue to see some of these trends continue. Behaviors are obviously changing, and what was once a nice to have now having become a necessity in terms of the flexibility and availability. I suspect these services will continue to persist. The other thing to note, though, is that this telehealth piece is also helping make care much more accessible to those that may have had barriers to seeing a physician regularly. Having these virtual appointments really allows you, whether you've got a phone, if you have a split scale or blood pressure medicine or machine at home, to have those metrics, but it gives you an opportunity to engage with those practitioners on a much more regular basis and ultimately set a higher baseline in care overall. So this kind of brings us to kind of our penultimate view of these industry trends, and that's really understanding the who, the where, the cost, and really the options as it pertains to the move from volume to value, ultimately the costs that are being absorbed by patients, the increased need for price transparency, the shopping for healthcare that is really resulting from that, and then with the emergence of COVID, really the availability of that healthcare through a multitude of different care settings and mechanisms. So this brings us to our second polling question. Shannon, do you want to take it away?
Sure. So for the audience, which of the areas listed on the screen has become or is now a top priority for your organization as part of the pandemic response? Is it a focus on care management and preventive care, continuity of care and telehealth adoption, mitigating risk for at-risk populations with comorbidities, mitigating risk for populations with socioeconomic risk factors, or ensuring you have enough provider specialties to service at-risk population? Again, I'm going to give you a few seconds to make the selection, and then we will flip the screen. Okay. It's looking like most folks are focused on continuity of care and telehealth, along with mitigating risk for populations with socioeconomic risk factors. Rick, Rebecca, comments?
The continuity of care piece. Go ahead, Rebecca.
Sorry, go ahead. I was just going to say that the probably along the lines of what you're thinking, but the continuity of care and telehealth adoption is not surprising given the trends that we've been noticing as far as the telehealth adoption. The most immediate concern was making sure folks are still able to access the care that they need in the immediate sense, and then looking at how do we mitigate those risks. So I don't think this is terribly surprising. It's based on, the analysis that we've been seeing. But Rick, thoughts?
Yeah, I'm curious, and among the population that's on the phone, I know most businesses have been shifting gears to help with telehealth adoption. I'm curious to see where this ultimately lands in terms of the ability for telehealth to persist beyond this pandemic. I know settings of care in regards to telehealth being logged and billed consistently, and ultimately potential risks that could come through some of those digital mechanisms is an area that the industry is having a lot of discussion around. So In terms of that telehealth adoption, some recommendations for the folks on the phone would be to consider, as you put a telehealth platform in place, if you already have one in place, then these might be good safeguards to evaluate. And if you're currently taking the more of a shotgun approach where you're trying different technologies to figure out what works, what gets you in front of the greatest breadth of your population, which is something we've heard from some CIOs as we've been in discussion, is to think about the data security framework that's really required. So applications like knowledge-based authentication, making sure the person that's on the other end of the telehealth is who they say they are, so that they're, you have that comprehensive kind of identity assurance that goes with it, is an easy way to help safeguard their identities and the data that's ultimately being generated as a result of that care setting, their PHI, and all of the individual components that might be conveyed as part of that interaction with the practitioner. So as a top of mind kind of thing, that integration through things like knowledge-based authentication or device assessment, different mechanisms that a patient can use to enroll to or verify that they are who they say they are and they are coming in from a device that you would expect them to, are easy ways to have an extra layer of risk protection for those new settings of care. All right, so as we look beyond this initial poll, sorry, I think it jumped one slide too far. We're going to talk actually now about a couple different areas. First, decisions demanding data is one section we want to spend a little bit of time of, because we all know that you are challenged with making informed decisions within the industry, and there's a wealth of different intelligence that can help go down that path. So as we start to look at kind of decisions that demand data, we know that healthcare payers across the board invest heavily in the decisions they make about entering new markets, devising smart network development strategies, innovating through competitive product design. You all obviously need detailed data not only on individual providers and institutions, but really their real-world relationships with each other. And these can help you make decisions as to whether or not to move forward with your business as you look at entering a new market, expanding maybe the population that you're providing services to, or potential sources of risk. So over the next section, we're going to talk through a couple different areas. We're going to start by looking at first the decisions that demand data across the board. We'll talk a little bit of time on contracting and some of the data assets that are at your disposal to help as you're going through contract negotiations with different practitioners, as you're evaluating new network needs, and ultimately what that cost should be to your business. We'll take a bit of a deep dive into expansion, so evaluating some of the different market landscapes that you might want to enter, communities you might want to start to interact with if it's a managed population, and also the existing competition that's there. We'll talk a little bit about design, so using data to identify really the community needs to ensure that your members have access to the practitioners that they need and you have the right product makeup. And we'll talk also a little bit about detection, and this is alternate ways that you can identify potentially risky individuals or suspicious behaviors, and some of the different use cases that can kind of result with that, specifically for your SIUs or enrollment groups during that initial provider enrollment and credentialing phase. Ultimately, I think we're going to land on that success demands data as a whole, and that you all need access to intelligence, not just that which is within your scope and typical purview for your business to date, but some of the other industry data that's out there that can help you make more informed decisions as you might be evaluating some of these different use cases. So we're going to start by talking a little bit about the types of decisions that demand data, and I think it's worth calling out that the impact of the pandemic has really started to shift ultimately how all businesses are behaving over time. But we know that payers specifically, not only do you have a great pulse to this within your own business, but that you're actively seeking additional intelligence to inform your day-to-day decisions as you're contemplating moving into new markets that might have populations that are greatly infected or affected by the pandemic. As open enrollment is occurring and product design is becoming more top of mind, especially with disease response, and ultimately what the long-term implications are of the pandemic to the potential risk state of the population that you would seek to manage over time. So with that, Rebecca, I'm going to turn it over to you for this next piece.
Great, thank you, Rick. So we know that you as payers require really robust insights on entities in the healthcare landscape. Attaining them is a a challenging task. So those insights are difficult to capture because the market is shifting and evolving so rapidly, right? So doctors change practices and networks, the referral patterns are shifting. Individual providers learn to favor different facilities over time. Sometimes their influence on the market overall surges, and sometimes it fades. Some practices are growing large, others are condensing and specializing, and hospitals and other institutions mix and match specialty departments and staffing. And new technology is changing the game again and again. So in other words, we know that you as payers need to answer key questions about entities such as what happened, where did it happen, what did it cost, and those industry trends we reviewed are creating new challenges. Like looking at more and more detailed data is needed to manage the move from volume to value. The increased price transparency places new pressure on payers to develop more competitive products, requiring intelligence on where other payers play, who they serve, what rates they charge. And patient shopping for healthcare require that network development and product design be consumer focused. So claims data provides key information that you all need to be competitive, but much of that intelligence is really happening outside of your four walls. So while individual payers have a clear understanding, of the volumes and rates that happen in your own plans, there's a gap that we encounter when it comes to information on transactions among competing plans and payers. And that's what we're referring to as this industry claims intelligence. And that can really fill the gap between your internal data sources and your external, the external market data that you need to get really a full market view of all the claims activity. This can include diagnosis and procedure volumes across providers and facilities, referral patterns on real-world relationship data, both in and out of network, and reimbursement rates among competing plans and payers. So these industry claims data provides this crucial competitive intelligence to support your data-driven strategy for growth, recruitment, and negotiation that's going to meet the consumer's needs. So let's talk about these four main strategic decisions that Rick had just reviewed. We had the sort of four areas: the contracting, expansion, design, and detection, that would really benefit from industry-wide claims intelligence. So first, let's talk contracting. So payers, we know you need the right data for contract negotiations and network needs. Healthcare payer executives who are responsible for the contract negotiations with network providers and institutions need to know where their rates stand compared to their competitors. No payer wants to over or underpay, and each wants to attract the right mix of entities and practitioners that can most effectively meet the needs of its member population. So payers face a series of common questions with regard to contracting and rate negotiations, and ones that claims data can help answer, including especially the industry kind of claims data, so what's not just within house but externally. So what are my competitors' contracted rates? How do our rates compare with the market? Are we overpaying or underpaying? What's the best contracted rate by provider, facility, procedure, claim, code? Are these practitioner rates higher than his or her peers, or higher than the market norm? How can we attract and maintain the right mix of entities and practitioners? Do we have the right providers for our members? Who are the high-value physicians and facilities we should contract with? And how do we identify who those high-volume providers are by treatment type? So we know that you need to know more than what you can really glean from kind of in your own in-house when we're talking about contracting to really do the contracting negotiations effectively. So you need a full market view of competitive cost intelligence before you walk into those negotiations. The insights payers need can vary widely, but often include competitive intelligence based on codes, claims, or lines of business, place of service. We know payers are also interested in the payer makeup of each provider to inform their negotiations. And with remitted industry claims, specifically, so looking at what was paid, payers can evaluate rate metrics such as the min, median, mode, max, standard deviation for billed and charged amounts, paid amounts, allowed amounts, patient responsibility. So on the right, you can see an example of these metrics for an MRI. We see that payer 2 has higher price points and variation, while payer 4 has less variation and lower reimbursement rates. However, when we look at the mode payment, it's close to the same for payers 1, 2, and 3. And I realize this is small on the screen. But if you're payer 4 with a lower reimbursement rate, having this intelligence prior to your negotiation is really crucial to inform those discussions as you walk into it. claims assets really provide an opportunity to see a market level cost comparison, enabling payer executives to enter those negotiations with the tools you need to negotiate price points that are favorable to your business and your members. We know that some payers might want different layers of this data, so code level versus claim level. Some want both to start to look at market metrics and success criteria for performance measures, maybe what's a provider might cost their line of business over time. So there's a lot of insights you can glean from that remitted level of information. But whatever the focus, that remittance information can provide a strong, provide a starting point for your negotiations with providers, comparing reimbursement rates across payer contracts to see how they compare among your competition. And really, that's the bottom line, is that you need to be able to compare those contract costs. And this data provides a 360 really assessment of rates, market saturation, workload, so you can negotiate effectively, evaluate provider contracting decisions, and inform future network development strategies. So I'm going to turn it over to Rick for our next piece.
Thank you, Rebecca. That actually, I think, tees up, most of you will be already engaged in expansion level discussions as a result of those contract negotiations, sometimes stemming from them. We know that you are all ultimately responsible for your provider network's expansion, growing into new markets, either organically or through acquisitions. And you also know that there's fierce competition in every market. So that means moves must be bold, they must be focused, they must be fast when an opportunity for expansion arises. And this often requires detailed intelligence. So intelligence on the target markets, the providers, the facilities, their relationships, their volumes of different members that are going to be in each and for which purposes, the relationships that might exist between those providers in terms of either referral networks or even personal relationships or subject matter expertise relationships, and then ultimately the rates. So we're going to take a moment and talk through some of the different types of questions that folks are typically looking at as you look at expansion. And some of these, as mentioned, are kind of, where should we expand? Do we have the right providers for our members? Should we be adjusting our rates or our provider mix? And will that result in higher membership overall? There's also discussions that you can have and questions that will come out naturally as a result of expansion to evaluate workload across payers. Understanding which providers might have the capacity to expand treatment of your members, or ultimately where there might be other specialties that could be leveraged. And this starts to tread a little bit on the design piece, which we'll talk about in just a few minutes, but where there's other specialties that might have experience treating certain types of behaviors that can ultimately fill some of those coverage gaps. We see that with specifically a lot of more of the rural provider communities where you have populations that might not be centrally located to a large breadth of practitioners. And as a result, the practitioners that they do see have atypical expertise, sometimes with cardiology, sometimes doing different level specialty assessments that might be out of their GP kind of job description. So as we look at expansion as a whole, expansion really can help you gauge really where your business should grow at a couple different levels. It could be among the population or the type of line of business that you're focused on. It could be geographically. We know that information on volumes and costs at a variety of different levels, from physicians and facility to the population's demographics, specialty coverage availability, and the settings of care. These are all important things that will help you identify really the reimbursement rates, the contracted rates that you'll set with those practitioners from a contracting lens, and ultimately what your ROI would be if you were to enter one of these new markets for the very first time. While you all have access to this data within practitioners within your own network, as you're looking actively to expand, either growing your coverage or growing your business into new regions, knowing what's going on there, who the population is currently seeing, what the mix is, what rates were set, and ultimately who your key targets would be within those markets as you expand for network enrollment is kind of a critical piece of expansion that we want to shine the light that outside industry claims can really allow you to get that spotlight on and understand what the current makeup and landscape is they're in. Rebecca?
Yes, thanks, Rick. So let's talk a little bit about design, because I think that expansion really kind of naturally building into design and how you're going to design your product is kind of a natural next step, right? So claims data can also be used to enhance your design decisions by assessing the community need. So who is available to assure members have access to those needed services and treatments, and identify what it will cost you as you design those products. Healthcare, payer executives are who are responsible for product design know how they need to start, with a detailed understanding of their own provider networks and specialties to determine what could lead to new offerings, but they're often limited to their own data intelligence. Product design requires a full picture of that healthcare utilization, the volumes, the referral patterns, the key service lines, to really strategize what a future product could look like and who would be required to deliver it. So in order to do this, we know you must have details on what procedures and treatments need to be supported through the new product or whatever new offering you want to design, which providers and facilities should be targeted to be included. So some of the questions that are considered when we're fine-tuning, a product design: where can we expand? Rick was just talking a little bit about that. Where can you optimize and innovate? How do your rates and products compare to others? What's the best product mix for your members? What are the best rates for potential services rendered? Does your current product meet the community need? And how do we identify and fill gaps? If there is a community need and there is a gap there, how do we fill it? Where can we enhance member engagement? Do we need, increased, care management, for example? Are there skill sets we can leverage to fill coverage gaps? So if you're finding that you have a specialty area that's not, we don't have a whole lot of specialists in that area, but do you have any primary, care physicians that, work within that field? So even though they're not a specialty, they still can provide care in there, and they can fill some of that gap in your community and for your members. Which physicians and facilities could you recruit, and have key services been adopted due to outreach efforts? And we really start to see the industry trends talked about earlier coming to light here. This is where you as payers are challenged to respond to consumerism, balancing patient responsibility and competitive packages, and designing the right product mix tailored to the community need and member population. All these decisions can be vastly enhanced with line of sight into external industry claims along with your own internal claims data assets. So a challenge in product design is accounting for the provider networks needed to support new services and new service and sub-service lines. You all need to ensure that your network is appropriately staffed to meet member needs, from endocrinology to oncology to gastroenterology, for example. Using competitive intelligence derived from outside claims data to inform product design allows you to tailor your future offerings to meet your members' evolving needs. So looking at the visual on the right, it really highlights this. So let's say the lower left portion represents an in-network, kind of providers that are surrounding patient X who's being treated for prostate cancer, and also the facilities that kind of are in network. By leveraging external industry claims, we see a broader picture of key treatment providers and facilities, exposing new medical oncologists, radiologists, and urologists that treat large cohorts of prostate cancer patients in your geography. So these providers and facilities are good targets to consider for bringing in network. So I will pass that over to you, Rick, for the next section.
Thank you, Rebecca. As we move into the next section, we're going to talk a little bit about detection and pinpointing really potential fraud, waste, and abuse and other activities that can be supported by casting and gathering a wider net and broader set of data over all different provider interactions. Having worked with a number of different SIUs over the years, we know that there's a wealth of different questions that are top of mind, identifying potential sources of risk both as it enters the network and once it's in the network, how to identify where it continues to pop up, whether it's due to things like unbundling behavior, where there's additional provider education that needs to occur, opportunities for peer mentoring. But there's also a lens that outside data can add, and it comes through a couple different capacities. In some ways, it comes through either consumer or physician level or business level insights that can be gathered based on other known industry potential red flags or sources of suspicious behavior. It can also come from claims, and some of that claims piece from a detection lens is occurring in-house. You have large claims databases and repositories that are triggering a bunch of pre- and post-paid rules, and that's giving your SIU teams generally a fair starting place of things to work with. But SIUs are also looking beyond just that initial data that they have in-house. We know that there's many different associations and networks. We personally, as a company, sponsor CIRRUS, which is a contributory database among most of those SIU and other law enforcement type entities. It is an opportunity, as NHCA would say, to identify where there are many potential risk sources based on community intelligence. Another lens of community-based intelligence can come from industry claims, and that's leveraging these outside data assets in order to identify potential sources of risk based on their interactions with any other entities within the industry. As we all know, within healthcare, fraud, waste, and abuse, there's an opportunity to look for network risk, not only tied to things like high volume utilization, among entities in network, but those out-of-network insights can tell you where that behavior might be occurring elsewhere within the industry from the same practitioner that you're contracted with and have in network, and thus be an area for potential monitoring in-house. In many cases, this is instances that just require some re-education. It might be that someone's not accustomed to billing for a specific type of procedure, things like that. But in some cases, there is some intent behind it, and if that's the case, then there's an opportunity to do some realignment and re-education among the network, or ultimately make a decision if that is not advantageous to your network as a whole. So as many SIUs are engaged in these activities, outside claim volumes and resources can help provide a light on potential practitioners or facilities that have some of those underlying behaviors, and ultimately give you a shorter set of those that you might want to focus on over time as potential sources of risk to your network, either once they're in the door or even before you contracted with them and are in more of an active provider enrollment phase. It would be good to know that one practitioner might be coming in the door with higher volumes of specific claims that you would want to scrutinize from other payer entities than you might get if you were getting a peer that had different billing behaviors and practices. So this brings us to our next polling question. Shannon, take it away.
Yes, hi. This is our third and final polling question. For the audience, which area of your business would benefit most from industry claims and insights? For this one, you can select any that would apply, but we're curious to know whether you think you would use it for contracting and rate negotiation, expansion and acquisition, network and product design, FWA and risk detection, or something else, or not at all. Give you guys just a few seconds, and then we will move to the results. Oh, wow. It looks like contracting and rate negotiation definitely wins, followed by expansion and acquisition, network and product design, FWA and risk detection, and something else. So everyone appears to see that there is value in claims intelligence. Rick?
Thank you, Shannon. Those results are very insightful. I fully expected that contracting and rate negotiation piece to be top of mind among the respondents. It's an area that having insight into what your peers might be being billed for by different practitioners as you're considering contracting with them for the first time helps ensure that you're not the outlier, at least in a negative sense, and know where the average rates are within the industry for each of those among the specific practitioners, facilities, or geographies that you might be entering into in terms of a market. Rebecca, did you want to add?
No, I think that you covered that pretty well. Like, I think that we're talking about negotiation. I think that's at the end of the day, we're talking our bottom line, right? So when it comes to finances, so that doesn't terribly surprise me. And I think that there's a lot of different areas that I'm glad to see that there was a wide selection of how you can use it, because I think that's how we really see it, is that claims can really inform a lot of different decisions, which really tees us up next for success, really demands data, and that in kind of all these four areas we just talked about with contracting, expansion, design, and detection, we're really talking about that you need the right data as you're making those decisions. So I'm just going to the next slide here. So, and it's not just having data, but it's more than in-house and network data. on your existing members, providers, facilities, et cetera. Success demands the right data, which is going to include both your data and external industry claims intelligence. Competitive claims intelligence provides the clarity you need to succeed in that evolving marketplace. The healthcare industry, as we all know, is constantly morphing, and you are all challenged to remain innovative, responsive, and competitive in this ever-changing industry. So when you're considering how to do, or how to optimize your networks and design products, make informed expansion decisions, negotiate those contracts, and competitively, and mitigate potential risk and fraud. This is really meeting the needs of an ever-changing market requires access to the right data insights that can launch growth and innovation while maximizing the impact of your budget. And to do so, you really need access to robust claims data insights and that present a clear picture of the landscape, its players, opportunities, the risks, and successful payers leverage claims intelligence to provide a complete market view of data that can transform a payer's business. So I know that we're running close on time here, so I'm going to try to do my best to sum up on our last couple of portions here. So of all those really four, kind of primary use cases that we're talking about around contract negotiations, network expansion and design, and looking at assessing risk, we kind of categorize, the claims data. I think of like this claims, three legs of the claims data stool as reimbursements, volumes, and networks, which I'll just do a really high-level summary of as we move forward. So reimbursements, you're really looking at the what did they cost, right? So I think we covered this a little bit earlier in the presentation, that you're leveraging price variations by place of service, payer, geography. You're looking at min, median, mode, max. You're trying to understand the contracted rates. But this is already to create the right product design and mix at the right rate for you and your members. So as price transparency rules continue to evolve and consumers become more critical of out-of-pocket expenses, knowing how to price your product and plans is crucial to remain relevant and attractive to existing and potential member populations. And there's just a ton of data in the remittance portion of the claims. So talking volume, we know you have the data in-house on your own network, where your patients are being seen, their diagnoses, their physicians, the specialists that they see, where they're being treated. We know that you know that if they've been seen for their annual PCP visit in network. But what you don't know is that full external picture of the community volumes, how those treatment and care volumes vary by payer, and what your true market share is by specialty or service line, how your lines of business are comparing to other payers' lines of business. And this, using the intelligence that's in claims data, so looking at volumes and diagnoses, we're able to, in just some basic counts and aggregations, you can leverage that for market intelligence, optimization, network design, and recruitment. And then last of our third leg of the claims stool is really looking at networks. So like all kind of claims data we've been discussing, the value of the industry claims data is filling the gap for your organization to really uncover previously unknown provider relationships, connection, referral targets, and ultimately provide the opportunity to consider physicians for recruitment and inform product design. So I think, ultimately we're really talking about this claims data is really going to help you make those decisions in a successful manner and remain competitive. So I'm going to pass it over to Shannon for our last polling question.
Thanks, Rebecca. So for the audience, final question, which type of claims insights would be of greatest value to your organization? Would you prefer info on volumes, networks, reimbursements, or all of the above? Please take a few seconds and respond.
And I'm most excited to see all of the above.
All of the above.
We've
there
seen
you
across
go.
the board that each of those, we've seen across the board, Shannon, that each of those different data sets and insights really provide a level of intelligence that impacts all business decisions in some capacity, even those that are not necessarily tied to some of the use cases that we've discussed thus far. We find that there are implications for reimbursement data as you're starting to assess where practitioners are, not just from a volume lens of where they're practicing, but ultimately what they're costing during each of those care setting interactions. So it's very exciting to see that that is something that is top of mind across the board and that there's a need for in each part of your business and use cases. So I know we're nearing end of time, so we're going to open it at this point for some Q&A live from the group. Shannon, you want to take it away?
Sure. I will go ahead with question number 1. Are you able to provide an estimate of how much more competitive my pricing or contracting might be if I were to use external data?
So Shannon, yeah, that's actually a great point. So with LexisNexis, our product suite, we certainly do samples like that. So if your business is interested in having kind of that initial assessment of how you compare with some competitor pricing, if there's a specific market or geography or expansion decision that's top of mind for you, we'd be happy to collaborate and have some discussion and provide some of that sampling for some of the decisioning that you might need.
Great. One other question that came in from the audience. Can you help my plan understand which geographies we should expand into, or what my network should look like if I'm considering managing new populations, like Medicaid, for example?
Rebecca, do you want to answer that one?
Yeah, sure. I think that this is a great question when you're talking about expansion, Rick, because by looking at the volumes data, this is really where you're able to look at, even like by line of business, and I know we didn't have a chance to go into the visual on that slide, but being able to look at what that mix is in maybe a geography, whether it's a large geography or by state, you can even go down to, city or zip level, to see what that line of business mix is. So is it Medicare, Medicaid, commercial? And if you want to see, if you want to see what that population currently has and then what lines of business you're going to need as you move into that, certainly that's the type of insight that is perfect for the full kind of claims view that we're talking about. Great.
Well, guys, we are at the top of the hour, so any other questions that have come in, we will address those by email as, after this event. I'm going to go ahead and conclude today's live event. I thank you all for your time today, and thank you, Rick and Rebecca, for your insights. Really appreciate everyone joining us today. Thank you very much.
Thank you.
Thank you.